It's just like a leader.
So our first presenter is Jaden Litteral, and he's here to present on his topic. So,
all right, let's do it. How are y'all doing today? Hope everybody's doing good. Thank you guys for taking time out of your busy schedule to be here and listen to me present on my capstone presentation. I know it's a nice day outside and all you guys had to take time out of your day to be here, so appreciate every single one of you. Okay, so what I'm going to be talking about today is what are the most effective methods for inducing muscle hypertrophy in the elbow flexors and extensors. Now, that might sound like a lot of gibberish to everybody in here, but don't worry, I'm going to start defining everything for you. First off, before I do that, I'm going to tell you why I chose this topic. First of all, I'm working on becoming a personal trainer here soon, as soon as I get out of school. I'm a bodybuilding competitor. I competed in a show this past fall. And I want people to become the strongest versions of themselves. I want you guys to leave this today not with just an assignment done for a capstone, but something to help you benefit who you are as a person and to benefit maybe the body and health that you want, right? There's a lot of conflicting information on the topics I'm about to talk about. So just to go into that, letting you guys know if anybody is aware of certain issues on this topic, there's a lot of conflicting information, but I'm going to explain it and simplify it as well as I can for everybody. So first off, I'm going to be telling you what I'm going to be talking about today. First of all, I'm starting out with an introduction. So I'm going to introduce the topics, then I'm going to go into the background, talking about the anatomy, biomechanics, things of that nature. And then I'm going to go into some of the 3 key studies that I chose out of the over 25 studies that I reviewed for these topics. And then I'm going to go into a concluding the information I'm talking about to you guys today, and then a final direction of where I see this probably going in the future. So without further ado, I'm going to define a few terms, starting off with hypertrophy. Many of you probably know what this word means. This is the increase in muscle size, typically due to some form of a resistance training. So whether that be weight training or something like that, band training, that's going to provide a hypertrophic effect in your muscles that are going to cause the cross-sectional area to increase. Essentially, your muscles are going to get bigger and stronger, okay? Then planes, as far as planes go, this is some basic anatomy, but I'm going to be talking about a little bit of the sagittal plane, certain motions in the sagittal plane. So I'm going to define that term. The other planes are on the screen as well, but the sagittal divides the body into a left and right half. So any movements that have in the sagittal plane, for instance, arm motion in the sagittal plane would be occurring like this. And then I'm going to talk about electromyography. There is a study that involves electromyography, and that is essentially a technique used to measure the electrical activity in muscles and assess their activation level according to certain electrical impulses. Okay, so as far as the anatomy goes, I'm not going to talk about the biceps anatomy as much because I'm focusing on the triceps anatomy as far as positioning goes. I'm sure many of you already know this. Dr. Sled does a fantastic job of teaching the anatomy and the biomechanics in her classes, but she taught me most everything I know about this, but just as a refresher for you guys. So the long head of the triceps brachii muscle is going to attach at the scapula. Specifically, it is going to originate on the infraglenoid tubercle. So that's the only head of the tricep that actually crosses over the shoulder joint. So it's important to keep that in mind. I'm going to talk about that in a little bit. And then we have the lateral head, which is just the outermost head of the triceps. That is involved in elbow extension, not shoulder extension like the long head is. And this is important, as I'll talk about later. And it's also similar to the medial head, which is also going to be involved in solely elbow extension. They all have a common insertion, however, on the olecranon process of the ulna. So that is also important. I'm going to reference that here in our first study. But before I start that first study, I'm going to tell you what my 3 studies are based on. First off, the positioning aspect. Specifically, this is going to be related to the triceps brachii muscle, not so much the biceps. Then we're going to talk about intensity, which occurs in the biceps, specifically the study that I looked at. And then the last one, rep ranges and volume. It's actually going to be the second study, but the rep ranges and volume, that's going to be talking about both the extensors and flexors. So the first study I have, the purpose was to investigate how different heads of the triceps brachii were effective in certain contractions. So it used the EMG technology to be able to assess the muscle head activation. And that was done on 10 participants. They were all healthy adults. And in that study, as you can see right here, where I show this procedure, up here is where the EMG pads were placed on the individual's arms. And on the far right, you can also see an image that was taken from the study that essentially just shows where different degrees of shoulder elevation occurred in the sagittal plane. So starting from 0 degrees down by the side, going up incrementally 45, 90, 135, and then 180 degrees of shoulder flexion. Now, the reason they were looking at this to see the different activations is to see how this affected the triceps brachii muscle as we know the long head crosses over the shoulder, and to see maybe how best to isolate these muscles, as we know isolation is the best way to induce muscle hypertrophy in these different heads of the muscle. So there we go. Okay. So this is a lot, right? This is going to be the most complicated part of what I'm going to tell you guys today. So just bear with me here. I'm going to explain it and break it down very simple so you guys can understand it well. So this top 3 graphs, you're not going to have to worry about that too much. Essentially, I was just looking at the muscle force is highest ability to output force measured in newtons. So we can see the long heads on the left, the lateral heads in the middle here, and the medial head statistics are on the far right. Now, as far as force output goes, we see that there's not a lot of overlap in where these muscles are outputting their force as far as their leverages and things like that, where certain muscles are taking over. However, we see a much bigger difference once we move down to the EMG technology that was utilized to assess the muscle activation. Now, this is where it's going to get a little complicated. I'm going to explain these graphs here. So first off, at the x-axis right here, we see shoulder elevation angle. So that's going from that 0 down by the side and the sagittal plane all the way up to that 180 degrees, right? And then on the left side, or the y-axis, we see the elbow angle. So that's going to be going from anywhere from 10 degrees of flexion, 10 degrees of flexion all the way to 135, which is going to be the limit of your range of motion in the elbow. And so what's really interesting is when we look at this, the long head is most heavily influenced by the shoulder's position. And we can kind of see how this makes sense biomechanically due to its leverages. Because as we pull down the over, with the long head being over the shoulder joint, it is used in extension. So we see extension of the shoulder as we get closer to extending the shoulder here at 0 degrees, we really see it spike up here. And its EMG activation. And we also see a second spike over here at the top of the range of motion, so at that 180 degrees. This is very interesting. Actually, some certain studies, as you guys can see in that top right-hand corner, right below where it says results, the long head contraction is unique and is active in both higher and lower shoulder elevations due to its biomechanical leverages in these positions. And we see this in a certain study I looked at, actually being able to stretch the muscle and have it active in the stretch position was very beneficial in rendering that hypertrophic effect in those muscles. So that is very interesting when we look at that muscle, that not only just because even though it is not matching the levels of EMG activations that we see here at the extension, we do see that this is a very effective position to train this long head of the muscle in, right? And then as we go over to the lateral head, we see that it's very active in the shoulder elevation, also at around that 180 degrees of flexion, and anywhere in that limited range of motion from around 85 degrees to 110 degrees of elbow flexion. And this muscle, it should be noted, it's very hard to isolate. It plays more of a supportive role in the use of the triceps brachii muscle. And then also when we go over to the medial head, this is where we see a lot of this jump in the EMG. Actually, it's the highest point on here is around the middle area. So we're seeing also this 180 degrees of shoulder elevation, but we also see a lot of activation here where there's not a lot of other activation between these both of the other heads. So as far as isolation goes, we're not just looking for the highest point, we're also looking for where this muscle is going to be active, where the other muscles are not being active. So that's a very important point. So when we see that, actually, we see that the medial head can be working well around that 90 degrees of shoulder flexion. So around here, and that would be like a diamond push-up or a tape press or something like that, where you're doing a exercise that's going to be pushing out at that 90-degree angle right there. So that's a good way to isolate the medial head. As far as the lateral head goes, we see this overhead extension is really good, which also is going to benefit the long head, but it is the most isolated position we can put that lateral head in. So it's important to do some type of an overhead extension when we're doing training the triceps brachii muscle. And then lastly, we see back to the long head over here, that 0 degrees of flexion is also going to be very beneficial for the long head. I would be interested to see in future studies possibly, because there's not a negative range right here, or essentially back into extension because of the triceps role on extension. It would be very likely that these numbers might even increase, but the study didn't account for that. I'd be interested to see where that goes in the future, but I'm jumping a little bit into the direction here. So that's essentially what I have for that. And the reason for the vast disagreements that we see amongst everything is going to be because of this major overlap. I mean, if you guys look at these three bottom graphs, there is a lot of overlap between those three graphs. So a lot of people will say at different positions that the triceps head, they might say, oh, at your long head of your tricep, you can only work at 180 degrees, when that's simply just not the only place it can work. But that's one of the reasons for all the overlap we see. Okay, into the next study. These are going to be a lot more easier to understand than that, I promise you all. Okay, so the purpose of this second study was to find a dose response in the 1, 3, and 5 sets range. So they were training 3 times weekly for a 6-month period with this amount of dose. So they were trying to find this dose response to see is lower or higher rep ranges more effective in training the muscles in the arms. So the participants were actually a much more defined and large group than the previous study. Partially because the last study was a experimental design, as opposed to this is a randomized control trial. So the 48 participants were placed into 4 different groups, and they were all trained males in the Brazilian Navy, ages 18 to 35 years old. So this study is going to be looking at trained individuals. The third study that I'm going to talk about is going to look at untrained individuals. I just wanted to hit both those groups because there is very much so a difference between how trained individuals respond to this kind of a dose response versus untrained. So in this study, how this works was each of those participants were placed into one of those 4 groups. Each of those participants did 8 to 12 reps per set, followed by 90-second rest periods. The reason they say 8 to 12 is because progressive overload was implemented. Progressive overload essentially just meaning that the failure range was around 8 to 12 reps per set. So if you were to go into the gym and do a weight, you would say, I think I can get about 8-10 reps of that, right? Once you do those 8 to 12 reps, you might fail sooner, fail later. So they tried to, because of this, put an area of where these people are failing their rep ranges, also just to make sure that it was due to set volume and not just amount of weight being done. Because if everybody did the same amount of weight, that would be unfair to the 3-set group, because they're overall just doing less volume instead of set volume, which is what they were trying to isolate. So bicep curls and triceps extensions were done in this fashion. And then they utilized ultrasound technology to actually assess the thickness of the muscle tissue. Now, the muscle tissue graph from the ultrasound on the right is not a before and after. It is rather a extensors versus a flexors versus extensors muscle thickness. I just put that up there just so you guys kind of get an idea of what that would look like and how they assess measuring the thickness of the muscle that was increasing. Okay, so the outcome measures of this study were to, first of all, look for muscle strength, increase of 1 rep maximum. And then secondarily, which is the most important part that we're looking at, is the muscle hypertrophy aspect. So how much muscle was gained and measured via ultrasound technology. And then also local muscle endurance. So this is basically the graph that was produced from the study. As we see off the bat, the 5-set group did overwhelmingly well in comparison to the other groups. So we see this 15 weekly set range actually exceeding the 3 and 1 set ranges and being much more superior. As we see also the control group who did not do exercise went down, which would match with what we would assume in a 6-month period that the individuals would lose some of their muscles due to atrophy. And so when we look at the 5-set ranges, this is actually very interesting because a lot of people will argue that you should only be doing 3 sets or you should only be doing a very limited amount of sets, when actually this study presents that the opposite is true, specifically in trained individuals who might be more used to training with heavier loads and their bodies may be more accustomed to the intense stressors that are put on their body in that kind of training. So the third study, the purpose was to compare different intensities across groups of participants. So the way they did this, and it's very important to realize the fact that they did this without modifying volume as much as possible. So participants were divided into 1 of 4 groups. There's a low intensity 20% of 1 rep max group. So that would essentially mean the participants would all do their 1 rep max in a certain exercise, like a bicep curl. And then they would be required to do 20% of whatever that weight was for a certain amount of reps, as many as they could. They would go to volitional failure. And once they failed, the amount of weight that they did in total would be looked at by the other groups, and those other groups would have to match the amount of weight that they've done and the work that they've done, as in terms of moving it with Newton force with the other groups, so the 20% groups, and this was all monitored. So then we see there's a 40%, a 60%, and an 80% high intensity group. And then all the participants, like I said, did the same volume to ensure that that intensity was actually the variable causing the change, not the volume. So participants included healthy males, 30 of them. They were not resistance trained, as I mentioned earlier, and their ages and heights were also very close as well, as you can see on the screen. So as we get into this, I just do want to point this out. So the participants did do elbow flexor exercises. So this is going to be strictly like bicep curls. And as we see over here, when we go to the repetitions area, there's 67, for instance, this says they did 67.7 repetitions. So that means they failed at about 0.7 of the rep through. And plus or minus 18.7 is going to be how far left or right they could go to this number to during the entirety of the study. So those numbers may seem a little bit large, but the reason being is because it is very hard, especially with the wide, diverse amount of participants, not being able to measure exactly the amount of reps that they can do across the board, because not everybody's equal in strength. So the reason that they did this and they adjusted it, and as we see even towards the 80% with the heavier weight, that it's only 2.8 reps of difference over this entire time that the study was going. And regardless of that, we still see very defined results, which is important. The results found that the 80% intensity group did by far the best. And then descending in decreasing order, we see the 60% intensity and 40% intensity still did very well. However, they did not do as well as the 80% group, and the 20% group still did pretty good. Just not going to be on the level that we see on the 80, 60, and 40% groups. And what's interesting about this specifically is if we look at the 40% group, how closely it is at the post-12 week mark, we see that number is still very close to even the 80% and 60% groups. And this kind of calls into question some of the findings from the American College of Sports Medicine Association, as they defined that loads for hypertrophy need to exceed 65% or be equal to 65% of a person's 1 rep max to induce muscle hypertrophy, and the arm specifically, as we're looking at in this study. And so because of this, we think that this might be subject to more study and more direction in the future, as 40% seem to work very well. We also must take into account that these were untrained individuals, so that could have some effect on it. In any case, even 20% was still yielding some hypertrophic effect, and could be even effective for somebody who's a member of an older population, as maybe an attempt to stop atrophy from happening in the muscles or sarcopenia, and also possibly to prevent osteoporosis, as resistance training can help make the bones more dense. So the conclusions from these 3 studies. So first of all, the positioning study, positioning of the triceps is just very important. Like I said, from the 0 degrees, 90, and 180, I find that those results seem to make much more sense. And also, as far as isolation goes, it's very important to not neglect any part of the tricep. So I found that study very interesting. The rep ranges study, which was the second study, shows how the 5 sets variation is more favorable than the 3 or 1 set variations. And then lastly, the intensity study that we looked at, it's very important because between 40 and 80%, we're still seeing very high increases in muscle hypertrophy. So if I were to recommend somebody to train for muscle hypertrophy, I would say for the arms, make sure that the positioning is correct, make sure the rep ranges are going to be in that higher rep range, especially if they're already trained individuals and young individuals. And then also lastly, that the intensity would be as high as they can get it without causing themselves harm or damage or any issues health-wise. So that is my conclusions on that, as well as the limitations of the study. The first study, there was a small population. That was the main limitation I saw with it, but also it was an experimental study and it was EMG technology. And across the board, those that data that we see makes a lot of sense, even just biomechanically. So I think it's a very sound study. The rep ranges study, the second study, I think that something that could have been changes is that more rep ranges were looked at. In my research, I saw up to 8 rep ranges or 8 set rep ranges, and that starts to fall off. So I would say anywhere between 7 and 4 would be a good place to look at, as we see that the dose response at 4, anywhere to 7 could possibly even yield better results. And then lastly, the intensity study only lasted 12 weeks. So the results can't be represented as well. It would be better to have a longer term study. And then the participants were young men without previous experience. And then obviously the second rep range set was people with trained experience. As far as clinical application goes, just to throw this in here, resistance training in any capacity does help decrease risk of all-cause mortality by 10 to 17%, including type 2 diabetes, which is due to the muscle mass increasing the insulin sensitivity. So that can help with type 2 diabetes. Also, resistance training can help prevent osteoporosis and sarcopenia. And then there's increases in strength for daily tasks for working individuals and even possibly for athletes to prevent or restore function after injury, or anybody who's had any issues with injury, as we can see. So in the arms. And then as far as direction goes, trained versus untrained individuals, I would like to say, just to reiterate, I think that the studies where we see the trained versus untrained individuals, there could be more done there to look at the difference between trained versus untrained people. And then direction. As far as drop set training, this is something that was very interesting to me, is there's not a lot of literature on drop set training. So for anybody that's not familiar, this is just a quick demonstration. Say somebody's working with 80% intensity of their 1 rep max. They're doing a rep, they do another rep, they do another rep until they can't do that rep anymore. This bar on the left represents energy expenditure and ability to produce force. So they're not able to do that last rep. So they would fail. They would go as far as they could, fail, then possibly drop the weight and do 40% of their 1 rep maximum, and then drop the weight again and do 20% until they've reached, ideally, an energy expenditure that hits the maximum their muscles are able to produce. Now, there's a lot of conflicting points in this literature, so that's very interesting to me that there wasn't a lot of literature on it. First of all, talking about it almost at all, and second of all, I think that as far as correlating with the intensity that I mentioned earlier and rep ranges, something like that could be implemented to even further increase the hypertrophic effect in a quicker time span on individuals training. The last thing is going to be rest period studies, something that maybe assesses where rest periods can happen, possibly splitting like the 15 sets that were done over the second study into 7 sets and then 8 sets on another day with more rest time in between to maybe allow for more recovery, something like that. And then like splitting volume based on week, like I just mentioned. So that is my presentation. If anybody would like to ask questions on what I've just presented, you should feel free to ask them at this time. Yes.
I think it was in the second study. You talked about it looking at the 5 sets as being kind of the ideal or the most effective.
Yeah.
I think what you said was the others were compared in a way of making sure they had the same overall volume. So does that mean that reps within those sets were not critical? Or was there a set amount of reps that they were also targeting?
So they were still targeting that 8 to 12 rep range.
Okay.
So as far as 8 to 12 reps, they would increase or decrease the weight depending on what group they're in to hit that 8 to 12 rep range, as that has been shown to be the most effective rep range for hypertrophic response in other literature. So that's what they based it off of as far as that went for rep ranges. Yeah. Anybody else? Yes, Dr. Slater.
Thank you. Yeah, so the first study looked at force and EMG, but it didn't directly measure muscle volume, is that right? But I guess the authors induced from if it had greater EMG activity would lead to greater hypertrophy.
Yes, that's correct. Yeah, that's correct. Just to see where the most those electrical impulses in the muscle are at. They did not take any ultrasound tests or anything like that. It was just kind of assumed and implied.
Yeah.
So yeah, yes, that's correct. Yeah, absolutely.
about like females in these types of tests versus males?
So typically there's some studies, they're typically not as in depth that I found. Typically, as far as resistance training goes, for whatever reason, they tend to recruit male participants instead. Now, that's not to say that there aren't a lot, but as far as this in depth of topics go, not as much information on the female response to it. It is, I would say, pretty similar for the most part. We see in resistance trained females that they can do a lot of volume, but with their hormonal balances being different than a male, it is more optimal for them to not maybe go as intense. So I would assume that in a study that would be represented with females instead, like such as the intensity study, that we'd see that lower intensity maybe yielding a higher hypertrophic response in females. So yeah, thanks for asking.
So in light of the questions from the back, you're looking at going into personal training.
Yeah.
Does that type of thing, male versus female, with a lot of these studies being done male, impact how you think you might present or direct their program?
Yeah, absolutely. So when we look at female responses, as far as training goes, as far as them training to failure and things like that, these are solids that work regardless if you're male or female. The main thing that's separate, like besides the intensity of them being able to maybe do a little less intensity or something like that, would really be like the nutritional aspect. So if a female was preparing for a bodybuilding show or something like that, their diet would have to be much different to account for their hormonal balances to make sure certain female hormonal responses stay on track, such as the menstrual cycle and things like that. That's something that we see in a lot of studies. So, yeah. Anybody else?
Good job, Jaden.